Real-world evidence as a domain has been gaining increasing attention, with health authorities providing formal guidance on the generation and use of such evidence and integrating it into decision-making processes for healthcare. So, what is real-world evidence and data? How can we make the best use of real-world evidence at Alexion, AstraZeneca Rare Disease Business Unit? Let's explore this together. Real-world evidence is evidence generated from analyzing real-world data, which is obtained outside the context of randomized controlled trials. In other words, real-world evidence is generated using data collected during routine clinical practice and in real life where patients vary in their socio-demographic characteristics, disease presentation, and treatment allocation. Real-world evidence, or RWE studies, and randomized controlled trials, RCTs, each have different characteristics and considerations and can be used to answer different research questions. RCTs are the gold standard for isolating and quantifying the real effect of the intervention, and RWE studies enable quantifying the effect of the intervention in the presence of other interacting factors. This leads us to defining the difference between randomized controlled trials and real-world evidence studies. In randomized controlled trials, patients often share similar profiles and are selected via strict eligibility criteria, but this doesn't reflect real life. Real-world evidence brings insights from a more diverse group of patients that usually present in routine clinical practice with varying characteristics. RCTs in rare diseases tend to have a few patients. Real-world evidence studies enable data collection from more patients. From a research question perspective, RCTs demonstrate how treatments work under highly controlled conditions. This is called efficacy. RWE, on the other hand, evaluates effectiveness. It provides the opportunity to systematically evaluate the use, benefits, and risks of medical products in more clinically diverse settings and patient groups, under conditions that reflect the use of treatments in actual clinical practice. Together, randomized controlled trials and real-world evidence complement each other, providing the full picture of efficacy and effectiveness of new treatments. However, real-world evidence studies provide the opportunity to investigate a wide range of topics beyond the effectiveness of an intervention. These topics become more relevant at particular stages of treatment life cycle. In the drug development phases, real-world evidence generation is focused on the epidemiology and natural history of disease, identifying unmet medical needs, quantifying disease burden, and mapping patient journey and treatment patterns. Before a treatment is launched in the market, real-world historical control data can be used to complement single-arm trials where a placebo arm would be unethical. After treatment launch, real-world evidence is focused on patient experience and preferences, treatment effectiveness, safety and adherence, and healthcare resource utilization. However, some of these topics can be covered at different life cycle stages, depending on the business questions in need for clarification at the stage involved. Real-world data comes from a variety of sources including clinic, pharmacy and hospital records, and laboratory and genomics data. Data coming from these sources can be organized into different databases depending on the purpose of the database. These include disease registries, drug registries, claims databases, and institutional databases at outpatient clinics, hospitals, laboratories, or pharmacies. When considering a data source or a database for a real-world evidence study, its fit for purpose should be assessed on the content and the logistics perspectives. With the ability to link data from multiple sources together, the possibilities for real-world evidence generation become endless. Imagine being able to track patients at their outpatient clinics, pharmacies, laboratories, hospitals, and emergency departments, as well as gather data from patients directly via surveys administered through multiple platforms or indirectly from digital sensors. You can basically answer countless research questions via analyzing this linked data. Real-world evidence studies can be classified as primary data collection, dealing with newly collected data, or as secondary data analysis of data collected previously for another research question. Prospective studies deal with primary data collection. and retrospective studies deal with secondary data analysis. Prospective studies include surveys, registries, or prospective cohorts. Retrospective studies include database analyses, retrospective cohorts, or chart reviews. Hybrid studies include prospective and retrospective elements. For example, retrospective chart reviews can be complemented with additional prospective data collection via surveys to patients. Alexion has been realizing the potential of real-world evidence in multiple ways along the entire treatment life cycle, more specifically via natural disease history cohorts as control arms for single-arm trials, as well as via disease registries, which have been collecting data for years in many countries. In 2020, Alexion Real-World Evidence Center of Excellence has been established by the Global Health Economics and Outcomes Research and the International and Japan Medical Affairs teams to create and deliver a single unified vision for real-world evidence generation and to support the affiliates with their evidence generation needs. Together, we navigate the real world for the benefits of our patients.